Hi, my name is Dr. David Wright, and I want to welcome you to the Fresh Start podcast. Um, I've been wanting to do this for a long time, and I've kind of been procrastinating about it. I've been putting it off, and I actually know the reasons why I've been putting it off, but I think it's really, really important to kind of understand the root causes of why we do things, look at them, accept them, examine them further, explore, and then come up with solutions. And I think if you take a solution centered approach towards life and mental health and wellness and things like that, I think that you're more likely to have long term, solid solutions that last. So, with that, I'd just like to welcome you. As I said, my name is Dr. David A. Wright. I am an MD. I graduated from medical school in 2010. I do not practice medicine, nor do I practice psychiatry. So I'd like to make that clear from the start. I don't practice medicine. I don't prescribe medications. I don't make diagnoses. And I don't practice psychiatry. And I'll go probably in an earlier podcast, I'll probably go into why I don't do that, but I'll talk about it a little bit here. Um, I think our healthcare system is, well, I won't use that word. I'll say challenged. I think our healthcare system is broken beyond belief. I think it's broken in so many ways. The question is, where do you even start on fixing it? I think it's broken for a number of reasons, and I don't think it's going to be fixed anytime soon. Um, I think it's been broken for a long time, and I think our mental health system, in many ways, is even more broken than our general healthcare system. And that's one of the purposes of this podcast, to talk about some of those issues, to talk about some of the issues that are facing patients, that are facing clients of mine, to talk about issues that are facing our country, our healthcare system, our mental health system, us as a species. I like to approach things from a philosophical standpoint, and I definitely like to look at the psychology of things, and then kind of the physics of things, why they work the way that they do, how do we change them, how do we fix them, what's likely to send it in the wrong direction, what's likely to send something in the right direction, and then everything else. So that's kind of the purpose of the podcast. Um, like I said, I do not practice medicine. I don't practice psychiatry. But I do have 5 practices. So I'll begin by introducing those. My first practice is MLC of Greater Atlanta. It is a holistic, integrative, functional, psychoanalytic practice that helps people move past their symptoms and their underlying issues in a very creative, root cause based way that helps them find solutions and build the mental muscles that are needed for them to be resilient, for them to move past things, for them to learn to sit in things. And I help my clients move past a lot of problems ranging from anxiety to PTSD symptoms to panic symptoms to depression to seasonal affective disorder, ADHD. That's one of my specialties, helping people with ADHD symptoms, especially without medications. So there are a lot of things that you can do to help people move past ADHD symptoms without prescription stimulants, which cause another host of issues, which I'll also be talking about later on. That's my first practice. I started it in 2016. It does really well, and it's growing. And you can go to our website, mlcoga.com, and look at all the reviews and testimonials that people have left about the practice. I started my second practice, Atlanta Coaching and Hypnotherapy Associates, which is a life coaching and hypnosis and hypnotherapy practice, in 2019. And then last year, in 2021, I started the last 3 practices, which are Atlanta Health and Wellness Coaching, which is a coaching practice based on helping people with nutrition, diet, wellness, health, and weight loss. And it's based off of my book, The Nutrient Diet, and the principles that are presented within the nutrient diet, which is the first book that takes a dual approach to diet, nutrition, health, wellness, uh, and weight loss. The first half of the book being explaining and talking about the metabolism of food and what your body does with the things that you put in it. And then the second half of the book is the psychology of why we eat and how to change it. So I think it's the first book of its kind, and I'm really, really proud of it. It's called The Nutrient Diet, and it is on Amazon. I also have two self improvement books. My first self improvement book was Sweet Potato Pie for the Spirit, Soul, and Psyche, which is attributed to Oprah Winfrey. So it's my way of kind of thanking her for her motivational quotes and just kind of the approach that she takes. And then my second self improvement book is Tomato Bisque for the Brain, which is another book with a bunch of psychological and empowerment oriented principles. And then both books are chock full of daily positive affirmations. And so those are those. And then my the other two practices that I started, um, Atlanta Small Business Incubator is a practice that I started to help people who want to add an additional source of income, who want to do some consulting work or create a consulting firm based on a hobby, an idea, or a skill set that they already have, and people who want to grow vocationally and professionally. So that's why I started that practice, and just to help businesses start and help them grow and move past growing pains. And then the last practice is Atlanta Academic Achievement, which is a tutoring academic achievement practice that is aimed at helping people with things like ADHD, with test preparation, for just kind of general learning, for studying, for memorizing material, and just kind of academic skills. So those are the practices that I have. I mentioned one of the websites. MLC of Greater Atlanta is www.mlcoga.com. Atlanta Coaching and Hypnotherapy Associates is www.atlantacoaching.com. Atlanta Health and Wellness Coaching is www.atlantahealthandwellness.com. And then the Atlanta Small Business Incubator is www.atlantasmallbusinessincubator.com. So you can check me out online. You can also check me out in a lot of other places. There are Facebook pages for each one of my practices. I do post regularly on Facebook. I post a lot of the things that I cook, a lot of the meals that I prepare. I'm a huge proponent of fresh vegetables and baked fish, so you'll frequently see me, sharing images of what I make for dinner after working all day, and those kind of things. So anyway, those are my practices. I've told you a little bit about my books. You can also find me in a lot of other places. I'm on heal.me platform. I'm on Google, so I have Google business pages, and then I'm also on Bird Eye and Psychology Today. So those are some of the places that you can find me online. Let me tell you a little bit more about this podcast, and kind of why I decided to start it. As I mentioned earlier, our healthcare system is severely broken. And generally speaking, unfortunately, it's heavily driven by three different parties: insurance companies, which are in business to make money; pharmaceutical companies, which are in the business of making drugs, but also in the business of making money; and then large healthcare organizations, hospitals, etc., that are in the business of patient care, but are also in the business of making money. And so, one of the things that you'll notice in a lot of the things that I talk about is you'll see trends, and I'll say things in a way that should make it obvious that it's a pattern. It's not just a trend, but it's a pattern. So the three forces, and then let me add a couple others. You've got the FDA, which doesn't function the way that it used to, and then you've got different parts of the federal government, including administrative agencies. Um, you know, and so you've got all these parties that help create the healthcare experiences or lack thereof that people have. And then you have them all coming together. And like I said, the first three that I mentioned, generally speaking, are concerned with making money, business. They're businesses. And I think that's a big part of the problem, and I think that's part of the root. And I don't see it going away anytime soon. The other parties involved like the federal government or the FDA, you know, they have a lot of constraints, financial constraints and otherwise. I think they're limited in what they can do, what they do, and what they don't do, and what they can and can't do. And they're also limited in what they can do from the perspective of making patients, American citizens, have good healthcare experiences. So that's where all that comes in. And then on top of that, you add in healthcare administrators who have their objectives and motives. You add in physicians who have their objectives and their motives. And then you add in nurses and other healthcare professionals. So when you add all that in, it just changes things. And then when you start talking about whether people have insurance or whether they don't, whether they live in a rural area or whether they live in an urban area, and what kind of insurance they have, and what kind of policy is it, and what kind of policy is it not, and what's covered and what's not covered, and what medical conditions they have or are developing, or the ones that they don't have, and all those things, it just gets really, really, really crazy. So part of the reason why I want to do this is I want to kind of break some of that stuff down, talk about it. I also look forward to possibly having guests on my podcast. So I like to bring in new kind of outlooks, different outlooks that may differ from mine, which is fine, and those types of things. But I definitely want to talk about some of the major problems in healthcare in this country, and I want to talk about some of the things that we can do and some of the things we should consider when we think about solutions, or when we talk about the possibility of coming out with new solutions to help people have better experiences. And then, of course, specifically, I want to talk about mental health in this country, and I want to talk about mental health, some of the barriers, some of the things that are preventing people from getting the care that they need, some of the huge mistakes that I think are occurring in mental health right now. One of those being kind of a push to have everyone on a pill, which is not a good thing. I don't think we need more pills. I think we need more real solutions, long-term solutions, and I think when you're talking about certain medical conditions, disorders, symptoms, a long-term pill approach is probably needed. Those would be things like hypertension and diabetes, etc. But when you're talking about other things, you don't always need a solution that's associated with just taking a pill every day, especially in the long term. And as we've learned with recent and ongoing opioid epidemics, it's not always a good solution, and frequently it's a bad one. And that, I would also say the same thing goes for other epidemics that we have that we're not really talking about, with people on benzodiazepines like Xanax and Ativan and Valium, and people on prescription stimulants like Vyvanse and Adderall and Ritalin. So those are some of the things that I look forward to talking about. I hope that you will listen into this podcast. It is an Apple podcast, so you can find it on Apple. You should be able to find it within the iTunes store. And I'll also be sharing links on my Facebook pages about it and posting about the podcast from my Google business pages. So welcome to the Fresh Start podcast. I look forward to talking about things, raising some issues freshly, and then also starting to talk about some good, solid, long-term solutions. So thanks for tuning in. This is Dr. David A. Wright from the Fresh Start podcast, and I look forward to chatting with you in the future. Bye-bye.